Good evening, good afternoon. My name is Sabina Onwonga, a student in DNPU 705 Healthy Communication class. I'm ready to do my presentation. Topic is Prevention of Childhood Obesity in Alabama County, United States of America. We find that 156 communities in Alabama, they are food deserts. This means that they lack access to healthy foods in groceries, and retail foods are contributing to some of the problems that children experience, and more so I'll be talking in the area of Alabama as a whole. This is the introduction. My approach, I'm going to use parent-led approach to develop and implement a campaign promoting healthy eating habits by increasing the caregivers' recognition of child obesity and the related healthy consequences. To start with, childhood obesity is linked to the lifestyle behaviors developed at a young age in the family context. We find that caregivers' knowledge, behavior, and attitudes affect factors linked to the childhood obesity, such as the screening behaviors, dietary, and physical activity. Therefore, obesity campaigns, they need to target parents and create awareness of childhood obesity and the risk factors involved. As parents, they play a major role in the childhood obesity. So increasing their awareness increases their relevance and the receptivity and improves success of this campaign. The county and the subpopulation at risk. We find that my campaign is targeting the obesity children aged 7 to 17 years in Alabama. According to the studies of the CDC, the obesity rate among the Alabama children aged from 10 to 17 is 21.8%, placing it fifth among the states with highest children with obesity rates. Over 1 million Alabamans live in areas with limited access to healthy foods in food retail outlets and grocery stores. As you can be able to see from the pictures on the right, most families are left with the option on relying on affordable fast foods, food retail, which has resulted nearly to 40% of the children being obese and overweight. Other leading factors of high obesity rates among children in Alabama are the poor eating habits, the bad climate, the poverty levels, and the Southern culture. We find that some of the cultural foods leading to obesity are the sweet tea, fried foods, Capri-Sun juices, chips, and cakes, which tend to be affordable to many. Lack of income also makes it hard for the families to buy the limited and expensive fresh vegetables. The importance of the campaign. Childhood obesity is a complex condition caused by multiple factors such as daily eating patterns, parental perception, genetics, environmental, and level of physical activity. The campaign will help reduce health risks associated with childhood obesity such as type 2 diabetes, the liver disease, high blood pressure, the stroke, and psychological problems such as anxiety, bullying, and low self-esteem. This effective campaign is going to encourage parents to feed children with a healthy diet. It's going to engage children in a healthy habit such as physical activity to influence activity levels and a better cognitive development. The figure on my side is the CDC data from the surveillance system in the 2021 showing the obesity rates in Alabama. Uh, the applicable healthy theory. The healthy theory applicable in the issue of the child obesity is the social cognitive theory. The theory is used to design physical activity programs and nutrition education linked to the prevention of obesity in adolescents and children. The social cognitive theory asserts that human behavior results from dynamic interaction between environmental, behavioral, and personal factors. The current campaign will employ the CST-based intervention preventing and treating obesity in children and adolescents. The behavioral factors that I mentioned, their health-related skills and knowledge, their personal factors, which are individual feelings and thoughts, there are environmental factors and external factors such as culture, climate, and poverty that affect individuals' healthy behaviors. The multimedia presentation for the campaign. The main materials required for the campaign are the computer with internet access, printing papers, and a printer. And my message is mainly intended to reach the parents of children and adolescents on the importance of healthy diet and regular physical activities to eliminate obesity among the young ones. So my main goal to my county is to encourage the physical activities and also good nutrition to reduce the number of obese cases and overweight children in Alabama area. The health communication campaign is going to utilize the mass media to distribute appropriate information to male and female on how to reduce and prevent childhood obesity. The campaign will use the internet and brochures, pamphlets to distribute information promoting nutrition and physical activities. The printed brochures will be distributed to different schools in Alabama and request children to share them with the parents. Through the internet, planners will share the same information via social media platforms to reach the parents who did not get the brochures. Finally, these are my references, and this comes to the end of my presentation. Thank you for taking time to listen, and I wish you all the best. Thank you so much.